Hi, I'm Siddhartha. I'm the founder and CEO of Walkbeat. What we work with is walking. Walking is one of the first things that you do when your child is born, and it's probably the last things you want to do before you leave the planet. And a huge part of the walking analysis as of today is only restricted to a lab. So what we do at Walkbeat is that we've created a tool that can analyze and monitor your walking behavior in real life, in everyday settings, but with clinical accuracy. And we do that for both humans and animals. I think we are inspired by our users, which is the caregivers and the patients. The caregivers want a tool to enable good treatment plans and good treatments to the patients, and at the same time the patients want to know how are they improving, is the treatment working or not, right? So we are basically at the middle of this interaction, and that's what inspires us, because we are able to provide value and create a better quality of living for actually both sides of the aisle. And that is why we decided to start Walkbeat. The biggest barrier from day one was usability. The reason why nothing like this exists or is used is because these technologies are so complex and so tough that regular physicians and doctors and neurologists are not able to spend time learning them and to be able to sort of adopt them in their practice. At the same time, the patients are not able to use it because they don't understand what it means. So the biggest barrier that we overcome was usability. Make it really simple to use, really simple to understand. Even though it's advanced analysis, it's still something that you can use in your everyday living. I think eventually, one day, just like Heartbeat was something that panned across industries, Walkbeat will be something that will probably touch everybody's life. Because according to WHO, 1 out of 6 people on the planet will have a mobility issue in their lifetime. So we are literally talking about a billion people problem. Eventually, Walkbeat will be seen not just in clinical settings, but also in everyday life, where people are more proactive about their health and not just reactive. There are a couple of things that we're looking for in this collaboration with France. One of the first major things is that we want to investigate different application areas, such as orthopedic or post-stroke rehabilitation or CNS disorders, and try to figure out which are those end users that are most interested and are ready to actually adopt this kind of technology in their life cycles, and at the same time be able to do those verification and validation tests together with end customers. Another part of this project is to sort of understand the regulatory roadmap that exists in integrating such digital solutions into the French healthcare system. So this is what we want to sort of work further in this collaboration, in this accelerator.